My final guest on today's program is also a doctor, and he's also co-sponsor of the Treat and Reduce Obesity Act. I'm pleased to be joined by Republican Congressman Brad Wenstrup from Ohio. I spoke to him a short while ago.
Congressman Wenstrup, thank you so much for joining us today. Look, I follow your tweets, as you know, and you had some real tough love language for folks out there and said that obesity is really one of the leading risk factors that has contributed to a lot of the deaths and a lot of the struggles with COVID. I'm just interested in that framing, and what do Americans need to know when it comes to kind of tackling an obesity epidemic?
Well, first of all, you need to understand what obesity does to your overall health. And maybe part of that is education within our country, maybe education within our schools. You know, when you are obese, it takes a tremendous toll on your body in so many ways. And we see diabetes that comes from this, end-stage renal disease, respiratory conditions, and last but certainly not least is all the orthopedic maladies that stem from carrying too much weight on your skeletal structure. And, you know, as a physician in my specialty, I saw that a lot. I specialized in treatment and surgery of the foot and ankle. Obesity led to a lot of the problems that people have. And so I think that education is a key part of it, Steve. I mean, I have a friend, for example, she's a chef, an outstanding chef from five-star restaurant. She started something called La Soup. And what she did is she took foods from grocery stores. They voluntarily would give them to her if they're about to expire, but before they expired, and create soup and get it to the needy and create meals for the needy. And then she also started going into schools with this and educating kids. And what really struck me one time is when she asked kids about vegetables and they didn't know what they were. And she said, well, what do you do when you dip your chip? What do you dip your chip in? She's thinking salsa, right? They all said cheese. I mean, so we have got a lot of education to do and also letting people really understand the deleterious effects of this. But, you know, some of it's the risk of bad behavior, and some of it is genetic or other underlying reasons that lead to the obesity. So we want to be able to treat the patient wholly, whether it's with medicines or other forms of therapy and treatment and change of diet.
Congressman, I want to get to one of the pieces of legislation that you've been sponsoring in a number of Congresses now and trying to push forward, but I want to get to that in a moment. Years ago, I probably had one of the most impactful roundtable discussions that I was asked to moderate in Baton Rouge, Louisiana. And the topic was this: it was on morbid obesity. And there was a young woman there who was the child of a multi-generation morbidly obese people. And sitting around this table were probably the best people in the world that were dealing with stigma, that were dealing with education, that were dealing on the healthcare front. And I had this young woman in front. She said, you know, the whole ecosystem where she was and where she grew up was stacked against her. And it was taking everything she could. So I want to just convey to our viewers, this is not a small thing. People feel as if they're taking on, you know, a tsunami of effects that are around them. And I just want to put that on the table with you, because I don't want to talk about this in a sterile or a clinical way. This is a big deal in terms of understanding the pressures that people feel, the stigma, the mental health dimensions. Am I right? And how are you trying to approach this and give some support to these people legislatively?
Yeah, so the legislation, you know, let me back up a second, Steve, because you mentioned COVID, and obesity is one of the vulnerabilities that make someone more prone to severe illness or death with COVID. But addressing this legislatively, what we want to do is really open the spectrum of care. So right now, what Medicare Part D doesn't do is allow medications that are needed to help fight obesity. What we're asking for is to allow for reimbursement and for coverage on 2 medications. We just want to start with, can we get 2 of our medications that are out there covered so that it's more accessible to people, right? Then there's also the idea of getting all of the team involved. So right now, if you want to do some intense behavioral therapy, it has to come from a physician or a nurse specialist or a physician's assistant. But if you want someone to see a clinical psychologist or a registered dietitian or a nutritional professional. You can't do that. So what our bill does is it allows coverage if there is a referral from a physician for these types of treatments, which is really all encompassing if you look at it with the two approaches that we're taking in this very bipartisan bill.
Well, in this Trust and Reduce Obesity Act, or TROA, is there a chance that this, reimbursability of certain medications and drugs combined with a shift in how we look at this, that do you think it might be able to be something that could dent obesity in this country at scale?
I think so, and I hope so. I worry in America that for some, it's obesity is okay. It's the way it is. It's who I am, and it's just okay. If you were sick with something else, then you would go get treatment for it. Well, this is a healthcare issue. It is a major healthcare issue because unfortunately, it is a precursor for other things that we clearly recognize are healthcare issues that I already mentioned.
What's the literacy level and support level among your colleagues about this? Because, I hear what you're saying, and I actually know it to be true, that obesity sits along with other comorbidities. It sometimes drives other health ailments and chronic conditions. And, in this kind of shift, when we were discussing healthcare reform, it was how to kind of begin dealing with the whole person. Why is this element, as you just said, sort of sitting out like an orphan in this and not looked at as core?
Well, I do think that that's changing, and probably a good example of that is the attitude in the medical community and across America outside the medical community is what we saw happen with addiction and with the opioid crisis. It used to be, well, if somebody wants to go and kill themselves by taking a lot of drugs, go ahead. But we also saw that a lot of people have this genetic disorder of addiction. And when they get started, it's impossible to stop unless it's thoroughly treated. And we started treating it as a healthcare issue. And I think that that's the right way to go. A lot of people innocently became addicted to drugs through prescriptions and everything else. We don't have to get into all of that. But if we can address this as a true healthcare issue by itself, I think America and the medical community are opening their eyes, because there are things in health that are the result of bad behavior. There's no doubt about it. But there's also things that are just a result of bad luck. And so you've got to embrace that a little bit more and work with people and try and let them to see how much more fulfilled their life can be.
So on the TROA Act, Congressman, what needs to happen now legislatively? Has it been scored? Has there been any effort by the Biden administration, since this is a bipartisan bill, to come in and try and pack you in with some of the other things they're doing? Where does it stand legislatively? What would you like to see happen?
Well, right now it stands alone, and we don't really have a CBO score yet. But here's the good news. There's an outside group called Avalier, and they have tried to evaluate it and said this will lead to cost savings. And here's why. When you treat something, if you can preempt the further damage that some health condition is causing, there's savings long term. I think, Steve, probably a good example of that is a cure for hepatitis C. Everyone said, oh my gosh, it costs so much. And maybe it was $8,000. And I believe it's come down quite a bit. But what you're not seeing as a result are the need for transplants, the need for repeated hospitalizations. So the more you can keep people healthy, and this is part of what we're doing. We got a lot of physicians in Congress, and we're trying to focus on the health span. How do we keep Americans healthier longer? To put it bluntly, none of us are getting out of here alive. But if we can keep people healthy as long as we possibly can, we'll probably extend lifespan and certainly make quality of life better.
Let me ask you one last question, Congressman. You're a co-chair of the Doctors Caucus. I really enjoy talking to your other colleagues in the Doctors Caucus. They sort of have a different take on many of these issues. But I guess the real issue I have is just your advice to people listening to this. We're sitting in communities around the nation, the policy community. You and I have talked about opioid addiction and what we need to begin doing. But the stigma side of this, like stigma, I don't get stigma, but stigma is part of the challenge in opioid addiction. It's also part of the challenge in obesity. What's your counsel on that? What do doctors in your doctor's caucus say we ought to begin doing to open our aperture on some of this?
Well, I'm glad you brought up stigma, and certainly I get that, right? As you grew up, Bill Cosby had Fat Albert, right? You had these stigmas out there, and I think what sometimes can be worse is when we try to ignore something because it might seem like you're stigmatizing it. And so I think we've got to address this, make people aware this is a healthcare issue. It's an American healthcare issue for sure. And we need to address it. And here's why. And so a lot of people come by this innocently. And it could be socioeconomic conditions. It could be genetic. There's a variety of things that can lead to this condition. And so we've got to address it wholeheartedly.
Well, Congressman Wenstrup, I want to remind our audience, and this was a dark day when this happened, but you were the doctor in the right moment and helped save Congressman Steve Scalise's life. You were a doctor in the right place in the Iraq War and saved so many folks that had been challenged there. You were Ohio's 2nd District Congressman. Thank you so much for joining us today.
Thank you, Steve. Pleasure.
Listen, these have been a set of powerful comments, and I'm going to add an editorial comment because there's always an opportunity for a learning moment. Obesity matters. It's a challenge, and obesity is a disease. It's out there. People are not obese. I just made reference to this hero, this young woman in Baton Rouge, Louisiana, and I talked about her parents being morbidly obese, and I wish I had not said that. They were challenged with obesity, and I just want to open people's minds about that. There are real people struggling with this. Do not objectify them. People are struggling with obesity. That's the framing we need to bring to this. And I want to thank you all for listening to these very, very powerful conversations. And that brings us to the end of our program. And a big thank you to Eli Lilly for its support and all of you attendees for joining us for this discussion. For any of you who missed the conversations, and they're really well worth watching again, I'm going to watch them again. We're going to have them up on our website shortly. I'm Steve Clemons. Thank you and be well.